Today I'm going to be doing a brief demonstration on how to assess for peripheral arterial disease using ankle brachial indices. You'll begin by evaluating the most proximal appendage, which would be the arm, and you want to evaluate the brachial artery for the blood pressure. The best way to attach a blood pressure cuff to a patient is to take their arm, rest it in your armpit, pull out the brachial cuff, wrap it around once and secure it with your thumb, and then wrap it around completely and secure it into place. You'll then want to use a Doppler, a continuous wave Doppler, to evaluate the arterial flow within the brachial artery, then inflate the cuff for the pressure. When the waveform comes back, that is your brachial pressure for that side. You'll then want to evaluate the contralateral side as well. If you notice a difference of more than 10 millimeters of mercury per side, you'll want to make note of that because that could indicate that there's a more proximal disease or occlusion or stenosis of some kind in the subclavian artery. Next, you'll move down to the ankles. Some patients will be able to assist you and be able to lift their leg. However, sometimes they can't. A good way to get the cuff on the leg if they can't is to have them bend their knee up slightly and then rest their heel down on the bed. You can then do the same technique of wrap once, secure with your thumb, and then complete the wrap to secure the cuff in place. You'll then want to evaluate the posterior tibial artery, which is found posterior to the medial malleolus, and the anterior tibial artery. And you'll do just as you did with the brachial arteries, you'll assess the waveform, and you can relax your leg down, sir. You'll assess the waveform, inflate the cuff, wait for the waveform to come back, and then write down that number as your blood pressure for that area. Another good thing to do that a lot of places don't is to also evaluate the dorsalis pedis artery on top of the foot and the peroneal artery posterior to the lateral malleolus. Evaluating the peroneal artery is a little bit more difficult. You have to push into the lateral malleolus and push up a little bit more. This will allow you to tell if there's 3-vessel runoff though, which will be beneficial to the physician to know the extent of disease. If a patient is diabetic, or if you've noticed that there is a significant disease in the patient, you can also take blood pressures in their toes to make sure that arterial flow is getting down to their toes.